Well, hi everybody. My name's Ken Green. I'm a volunteer speaker for Prostate Cancer UK, concentrating on trying to raise awareness of prostate cancer. You may have seen the latest TV advert where it's rather hard hitting, saying that one man dies every 45 minutes in the UK with prostate cancer. And unfortunately, due to the pandemic, with doctors being involved in other works, and I think people may be reluctant to go to surgeries, it's been estimated that 14,000 men have fallen through the gaps and should have been diagnosed with prostate cancer. So if we can go to the slideshow, I can talk you through prostate cancer and knowing your risks, which is what we're trying to do. Right, so basically this is a quick talk. I hope I don't go too fast on it, but it's just to give you food for thought on knowing your risks about getting prostate cancer. If we can go to the next slide. Know your prostate. Well, firstly, I have to say that this is dear to my heart, or dare I say nether regions, because some 12 years ago, I was diagnosed with prostate cancer. Fortunately, in my case, if you can call it that, it was low risk and still is. And after consultations with my consultant, with the appropriate name of Mr. Cox, my wife and I decided to go on what's called an awareness course. And basically, I have my PSA, which I'll discuss later on, checked every 3 to 6 months to make sure it stays at a reasonable level. I didn't opt for any surgery, and I'm quite happy, might not be the right word, but I'm comfortable living with prostate cancer. In the words of my surgeon, I'll almost certainly die with it and not of it. And many men over 80s, probably the majority of men in their 80s will have prostate cancer or an enlarged prostate, and it's not going to be the killer. So know your prostate. So if we go to the next slide, I know they say that the internet is a hypochondriac's dream. I didn't know anything about prostate. I knew I had a prostate being a man, but I didn't know anything about prostate cancer or what the prostate did. So what is a prostate? Well, it's a gland, like renal glands, sweat glands, and sits beneath the bladder. It's about the size of a walnut, and it fits around the urethra, which carries the urine from the bladder to the penis. And its job is to make semen. Now, it was always said that only men get prostate cancer, but latterly we realized that trans women, that's somebody who was born a man but identifies as a woman, can have a prostate, as can some non-binary people. So if we go to the next slide, we can look at the conditions that can affect the prostate. And we'll concentrate on 3 main ones. An enlarged prostate, which is probably the most common cause of problems that affect the prostate. And it's quite easy to find. A simple examination by your doctor will tell whether you have an enlarged prostate. And what that does is, if you can remember the previous slide, it actually squeezes the urethra and restricts the flow, so you can't really empty your bladder. So it can give conditions very similar to prostate cancer. You can have prostatitis, which is quite painful, but can be treated with antibiotics to get the inflammation down. Or there's prostate cancer itself, which is what I want to talk about. So if we go to the next slide, we can look at what is your risk. And that's what this is all about. Prostate Cancer UK have on their website what's called a risk checker. It's quite a simple little tool and takes you about 15 to 30 seconds to go through it. But it does give you ammunition, if you like, that you can go along to your GP and say, look, I am in the area of risk. Now, I didn't know what these risks were until I got it myself, and I was quite surprised. And if we look at the next slide, you can see it's quite surprising that 1 in 8 men, in fact, I think that's gone up now, it's about 1 in 7, will get prostate cancer within their lifetimes. And if you, unlike me, are unfortunate to support your local rugby side because they're not playing very well, you see 30 strapping young guys running out on the field. Well, 1 in 4 of them will get prostate cancer at some point in their lives. I'm sure they're not thinking about it at that age, but that's the kind of figure you're talking about. It's very, very high. If you're a black man, and black is defined as Afro-Caribbean, unfortunately, you've got a 1 in 4 chance of getting prostate cancer. Now, a lot of research is being done. Unfortunately, due to the pandemic, getting a bit of a plug in here, research in Prostate Cancer UK has really trickled down because the money hasn't been coming in. There haven't been any fund runs or whatever. But we need to do more research into why you can get prostate cancer and why black men are twice as likely to get it. Age 50 and over, that's not a magic figure, but that's a figure that's used. As I say, most men will get prostate cancer at some point in their lives, but it won't be life-threatening. But at the age of 50, we're starting to look at whether you have prostate problems and is it caused by prostate cancer. And the one that really hit me was if you have a family history, if you have a brother, uncle, or male relative, blood relative, you are 2.5 times more likely to get prostate cancer if they have had it or have it. It's not all doom and gloom. I mean, there are 400,000 people in the UK living with or after prostate cancer, and I'm, dare I say, living proof of that. You know, when you're told you have prostate cancer, the first thing you do is look for your life insurance and see how you're covered. But no, it's not doom and gloom. But the main thing is, and that's the reason for this talk, is we really, really have to get figures down. It's the 3rd biggest cancer killer in the UK. It's overtaken breast cancer. Now I know there are lies, down lies, and statistics. And fortunately for breast cancer, if you can call it that, they've had a campaign for many years. You see these vans in supermarkets where women can go along and get checked. We don't have anything like that at all for prostate cancer. So the figures are down for breast cancer, possibly because women get identified far, far earlier and there are more options. So the death rates are lowered because you can get treatment quicker. But anyway, we really have to get these figures down. So we need to know your risks. So if we can go to the next slide. And basically, what symptoms can you expect if you've got prostate cancer? And the next slide, please. Well, these are some of the common symptoms, and I have to say I've suffered from a few of these over the years. Needing to wee more often than usual, day or night. Well, that's the one that found mine. My wife said to me, Ken, come on, you know, you're getting up an awful lot in the night to go to the toilet, far more than often. And being typically trying to be macho anyway, you say, oh, come on, it's just my age. Everybody in my age gets that. It's not a problem. But we may think our wives nag us, but we love them really. And you listen to She Who Must Be Obeyed. She kept on, look, Ken, I'm not happy. You get yourself down the doctor. So I did. And quite a simple test called a DRE test. I've seen 20 stone prop forwards in rugby games wincing when I mentioned this, saying I'm not having that done to me. But I can't understand why not, because the doctor will insert his or her finger in your back passage and within 20 seconds will determine if your prostate is swollen. And the line I use is, for God's sake, don't die of embarrassment. The doctor won't be embarrassed, so why should you? So that's how they found out I had a swollen prostate, which I then was referred to the clinic in the Royal Gwent Hospital, and I can't speak too highly of them. And the further tests showed that I did have prostate cancer. So look out for that. If you're going more often than not, and I don't mean after, dare I say, a night out with the boys on a Saturday night where you've had a lot of beer. I mean, your day-to-day living, are you really going to the toilet more often than usual? Difficulty starting to go to the toilet? You think you want to go, but because that urethra is squeezed with the enlarged prostate, which could be caused by cancer or just an enlarged prostate itself, then you can't empty your bladder. Straining or taking a long time to finish weeing for the same reason. Your bladder still is holding urine and you can't get it out. A weak flow. If you are in the unfortunate position of being referred to a prostate clinic, because they think you've got problems, then normally the consultant will show a chart on the wall. I can't demonstrate it, but basically it's of a man peeing against a wall with the relevant heights of when he's peeing. Now, if I can introduce a joke here, and apologies for this in advance, we've gone to the days when we could write our names in the snow. I mean, as you get older, your flow will naturally weaken. But what we're looking for is a noticeably weaker flow. And I think in my case, I was at the watch your boot stage. when I looked at the chart on the wall. So again, this is another thing to look out for. Is your flow of urine noticeably weaker than it used to be? The feeling you haven't emptied your bladder properly. You go to the toilet, you think you're finished, you come out and you think, hell, I've got to go back in again. I still want to go. Needing to rush to wee. This is a tricky one. And sometimes you can't make it. I think I know every toilet within the 20-mile vicinity of where I live in all the pubs and shops, because you've got this half a minute, if you're lucky, sometimes less than that, to get to the toilet, because your bladder has filled up, but it's restricted. It can't come out, but all of a sudden it has to come out. The pipe will burst at some point, so you have to rush. And the last one is dribbling urine after you finish weeing. You think you finished, and again, dare I say, it can be quite embarrassing on a Saturday night. You've got a nice pair of white chinos out with your friends, and all of a sudden you look down and you've got a damp patch where there shouldn't be. So again, maybe I'm making a few jokes about it, but trying to make light of a serious situation. This is what you have to look out for, these symptoms. So if we could go to the next slide, please. Right, thank you. At first glance, you think, well, you know, what's this all about? If I've got prostate cancer, most men with early stage cancer have no symptoms after telling you what symptoms to look out for. But basically what I'm saying is this is reality. Sometimes you start getting back pains, and that's when it's too late, because the prostate cancer has spread into the bones, and you really then have to look at serious treatments. So look out for the risks. Yes, okay, look out for the symptoms, but use the risk checker. Are you in the risk awareness zone, basically? You might not have any symptoms at all, but nevertheless, you might still be at risk. You might have a father or brother with it. You're the wrong age, dare I say. You know, there are things to look out for. So if we could go to the next slide. Basically, okay, you've done the risk checker, or you think you're at risk anyway. You've spoken to people, you may know somebody who's had it, and you think, well, hang on, I have no symptoms, or I have some of these symptoms. What do I do? Where do I go? Well, the action you can take, next slide, please. Well, firstly, you do have the right to a PSA test, and for what it's worth, PSA stands for prostate-specific antigen. And a simple blood test will tell you what antigens you've got in your prostate. You have the right to a PSA test if you're over 50. And as it says, if you have a family history of prostate cancer or you're black, you are at higher risk. Now, I am aware that there are some GPs who are saying, hang on, I don't want to give you a PSA test, certainly during the pandemic, because they had enough on their plates anyway. And also, the PSA test is a bit of a blunt instrument. The bad news is there is no definitive test to tell if you've got prostate cancer. The PSA test, you can have a high PSA and not have it. You can have a low PSA and have it. But nevertheless, if you do have a high PSA, the chances are you have problems. Could just be an enlarged prostate, but nevertheless, a high PSA could be problematic. But you need more than one, because you can have a high PSA, I've been told, if you've gone on a long cycle ride the day before. Even if you've had sex the night before, apparently it can give a distorted figure. So what your GP needs to do, or your urology clinic, is do a series of PSA tests. And that's what happens with me. And it tends to behave over the years like a sawtooth. Fortunately, in my case, it's not rising to the right, which is what you're looking out for. It can be up one minute, down the next. But you really need more than one PSA test, but it's one of the factors that you need to do, and you do have this right to a PSA test. So what can you do about it? Well, the next slide will just give you some ideas. If you think you're at high risk, and that risk checker I keep mentioning, as I say, it's quite a simple little tool. You might laugh at it using it, but at least it points in the right direction, and you can actually print it out. And it's on the Prostate Cancer UK website. You can either Google just Prostate Cancer UK, or if you can remember this, it's prostatecanceruk.org/risk checker. But you'll see it on the home page. And you can print it out, and you can speak to your GP and say, look, you know, I'm at risk. Here's my risks. Can I have further tests? Or you can speak to one of the specialist nurses on a free phone number. And believe me, having spoken to them in the past, they are very, very helpful. They know what they're talking about. Please share this information with people you know, even if you don't think you're at risk. And I normally ask for as many ladies as possible to come in on these talks, because they are the ones who are important. They're the ones who will nag us and get us talking about it. We can't be ostriches. We have to talk about it, as we did with the previous one with Nikki. You know, don't be ashamed if you think you've got prostate cancer. So what? I don't mind telling people I've got it. But certainly you need to talk about it. So share that information, check your risks. And I think the next slide just tells you what your risk, where the risk checker is. So it's about 30 seconds, even quicker than that. But we really, really need to attack these people who have fallen through the gaps and get these figures down. They are dangerously high. I know we're all living a lot longer, and we're tending to die of things we would have died of something else in the old days, TB or whatever. But cancer is now becoming the one that's being concentrated on. On the next slide, it's just a quick, if we could have it, thank you. Basically, it's just saying, look, okay, now we seem to be coming out of COVID, although the rates are going back up. But if you think you have a problem, please don't be an ostrich. Go along to your surgery or phone your GP. You might even have a consultation on the phone with you, but don't be afraid to go to the surgery. That's why some people may have fallen through the cracks, because you think, well, I'm not going down to surgery. I'm going to be mingling with people who might have COVID. Well, rest assured, certainly my surgery, and I'm sure all others, they are quite safe. You're well spaced out. You're only allowed in so many at a time. So don't stop that going along to it. And basically, that's it. I know I've flown through it. It was meant as an overview. Normally, these slides are a lot longer, but as it's a Zoom call, it's quite hard to be able to stretch it any further.